Cyanosis is a change in the color of body tissues to a bluish-purple color as a result of a reduction in the amount of oxygen bound to hemoglobin in the red blood cells at the base of the capillaries. Body tissues that show cyanosis are usually in locations where the skin is thinner, including mucous membranes, lips, nailbeds, and earlobes. Some medications containing amiodarone or silver, Mongolia spots, large birthmarks, and consumption of food products with blue or purple dye can also cause bluish discoloration of skin tissue and can be confused with cyanosis. The name cyanosis literally means blue disease or blue condition. It comes from the color cyan, which comes from cyanos, kyanos, the Greek word for blue. Postulated by Dr. Christian Lundsgaard that cyanosis was first described in 1749 by Jean-Baptiste de Sénac, a French doctor in the service of King Louis XV. De Sénac concluded from the autopsy that cyanosis was caused by a heart defect that caused mixing of arterial and venous blood circulation. But only in 1919, when Dr. Lundsgaard was able to reduce the concentration of deoxyhemoglobin, 8 volume%, which can cause cyanosis. Central cyanosis is often caused by circulatory or ventilation problems that cause poor oxygenation of the blood in the lungs. It develops when arterial oxygen saturation falls below 85% or 75%. Acute cyanosis can be caused by shortness of breath or choking and is one sure sign that ventilation is blocked. Peripheral cyanosis is a blue discoloration of the fingers or extremities, due to inadequate or obstructed circulation. The blood reaching the extremities is not rich in oxygen, and when viewed through the skin, a combination of factors can cause a blue color. All factors that contribute to central cyanosis can also lead to the appearance of peripheral symptoms, but peripheral cyanosis can be observed in the absence of cardiac or pulmonary failure. Small blood vessels can be restricted and can be treated by increasing the normal oxygenation level of the blood. Differential cyanosis is a bluish discoloration of the lower extremities but not the upper extremities and head. This is seen in patients with patent ductus arteriosus. Patients with large ducts develop progressive pulmonary vascular disease, and pressure overload of the right ventricle occurs. As soon as pulmonary pressure exceeds aortic pressure, shunt reversal, right to left shunt, occurs. The upper extremities remain pink because deoxygenated blood flows through the patent duct and directly into the descending aorta, while the brachiocephalic trunk, left common carotid and left subclavian arteries are spared.